In this video, we'll discuss complete claw hand. We have already discussed incomplete claw hand, which is due to ulnar palsy, which supplies the fourth and fifth ring and little fingers by third and fourth lumbrical. So what happens in complete claw hand? Complete claw hand or simian or ape's hand. There is a combined ulnar and median nerve palsy. So median nerve innervates the three thenar muscles and lateral two lumbricals. The lateral two lumbricals supply index and middle fingers. So what's the function of the lumbricals? They extend the interphalangeal joints and flex the metacarpophalangeal joints. Why do they extend interphalangeal joint and flex metacarpophalangeal joint? They flex metacarpophalangeal joints because they are in front at the wrist, but when they attach to the terminal phalanx, they are behind them, so they extend the interphalangeal joint. So median nerve lesion causes loss of lateral lumbrical functions, the second and the third digit, the index and the middle fingers, they are clawed. In combined ulnar and median nerve palsy, there is wasting of both thenar and hypothenar compartments. Ulnar nerve supplies the hypothenar compartment and median nerve supplies the thenar compartment. So what are the muscles of the thenar compartment? Abductor pollicis brevis, flexor pollicis brevis, and opponent's pollicis. Let's discuss the low median nerve injury. There is a sparing of the forearm muscles. The hand muscles are paralyzed. Wasting of thenar eminence. Thumb abduction and opposition are weak, and there is sensory loss over the radial 3.5 digits. So where is the sensory loss? It affects the front of the radial 3.5 digits and front of the hand and back of the 3.5 digits. It does not supply the back of the hand, which is supplied by the radial nerve. What's the effects of paralysis of the thenar eminence? There is loss of abduction of the thumb. There is loss of opposition of the thumb due to paralysis of opponent's pollicis. So what's opposition of the thumb? Thumb reaches across the palm to touch the fingers. This is the opposition of the thumb. And also there is loss of abduction of the thumb. There is inability to abduct the thumb, that is the ape's hand. Patient can't move the thumb away from rest of the hand. Abduction is lost. Thumb is rotated and flexed in this same plane as a finger and loses opposition. Why thumb is adducted? Because of unopposed action of adductor pollicis, which is supplied by the ulnar. So in ape's hand, the thumb is adducted and the fingers are flexed and there is loss of opposition. Ape's hand is also seen in Charcot-Marie Tooth disease. Let's discuss the proximal median nerve lesion. Median nerve arises from the medial and lateral cords of the brachial plexus, and which nerves it gives in the arm. Median nerve does not supply muscles in the arm. It supplies the muscles in the forearm. It supplies all the flexors in the anterior forearm except which muscles? Flexor carpi ulnaris and medial half of flexor digitorum profundus, which are supplied by the ulnar nerve. We already discussed that. So the muscles which are paralyzed as a result of high median nerve palsy are pronator teres, pronator quadrator, flexor carpi radialis, flexor digitorum superficialis, flexor digitorum profundus, second and third, which applies to the index and middle finger, and flexor pollicis longus, and sensory loss as well. What's a high median nerve palsy? A high median nerve palsy is above the origin of anterior interosseous nerve. So what are the effects of the medial nerve injury? Weakness of forearm pronation, weakness of wrist flexion and abduction. Patient cannot write because writing is a function of the thumb and index and the middle finger, and there is loss of lateral two lumbricals along with the other muscles of the forearm which are supplied by the median nerve. Patient cannot make a fist, and number 3, patient cannot make O sign with thumb and index. So what's the O sign or OK sign? Normally when thumb and the index finger they meet each other, they flex. This is the O sign, and this sign is a normal sign, but this sign is negative in anterior interosseous nerve injury. So the patient is unable to touch the tips of the thumb and index finger. So what muscles are paralyzed in this condition? Flexor pollicis longus and flexor digitorum profundus, because in O sign both the interphalangeal joints of the thumb and index fingers are flexed. Flexor pollicis longus flexes the thumb and flexor digitorum profundus flexes the index finger interphalangeal joint. And instead of flexion at this interphalangeal joint, these joints become extended, pinched. What's a bishop hand or benediction hand deformity? In bishop hand deformity, ulnar nerve is normal and median nerve is abnormal. So median nerve supply the lateral two lumbricals. So patient cannot make a fist because index and middle fingers are affected. The lateral two lumbrical muscles are paralyzed, and also there is inability of the thumb to flex. So what happens in benediction sign? When patient is asked to make a fist, they will be able to flex the digit 4 and 5th little and the ring fingers, which are supplied by the ulnar nerve, which is normal, but they won't be able to flex the index and middle finger. Thumb is also involved. And why is it due to? This is due to paralysis of the flexor digitorum profundus and flexor pollicis longus. Flexor digitorum profundus flexes the index finger and flexor pollicis longus flexes the thumb.